Good afternoon, everyone. Thank you so much for joining us at Families Together's second town hall for 2024. As any of you who have attended in the past know, this is a great opportunity for everyone across the state to hear directly from the leaders in this case, the addiction and recovery field, the commissioner of the OASIS and the assembly member who's the chair of the Alcohol and Substance Abuse Committee in the Assembly and the chair in the Senate, who will be joining us shortly. So I'm Paige Pierce, I'm the CEO at Families Together, and we are thrilled to be able to continue to do these town halls to give everyone the opportunity to not only hear directly from the leaders, but also to ask very poignant questions of the leaders in an opportunity for them to really answer those questions in a meaningful way. I also want to just take a second to thank Brad Hansen and Zach Kilmer, who are and Cheryl Williams, who are the policy team at Families Together, who have put these together and are working very hard on the Family Empowerment Day, which is on March 18th here in Albany. So I'd like to just take a second to introduce the Commissioner of OASIS so that she can introduce herself and tell a little bit about what they're doing over there at OASIS. Commissioner?
Great. Good afternoon, and thank you for having me on today. I'm happy to talk about what we're doing at OASIS. Really, with the worst overdose epidemic in history, we are embracing harm reduction, a data-driven approach, and really using an equity lens in everything we do. And so harm reduction not only includes harm reduction materials and supplies like naloxone and fentanyl and xylazine test strips, but also an approach to meet people where they are, to go out and really do outreach and reach those at highest risk. A data-driven approach is really using our data, making it transparent. We have dashboards on our website and having addiction data bulletins so that communities can know what's happening in their local community, and we can make sure that our resources are made appropriate for what's happening in all those communities and really following the data. And finally, an equity lens, we know that Black New Yorkers and Hispanic New Yorkers are dying at the highest rate, and we have to make sure that we acknowledge that, and that, again, that our resources really fund those who are at highest risk. It's not just about race and ethnicity, it's also about rural areas, LGBTQ status, gender, et cetera, but really using an equity lens to make sure we have equitable resources available across the state is also a key guiding principle. So that's in a nutshell, kind of what we're doing and how we're sort of following the science, the data, and equity.
Thank you so much, Commissioner. Next, I'd like to introduce Assemblyman Steck, who is the chair of Alcohol and Substance Abuse Committee in the Assembly. Assemblyman?
Well, of course, we meet with a lot of different providers and advocacy groups trying to consider their concerns, and invariably we find that the concerns have merit, but trying to do something about it is very, very difficult. Most of the concerns are budgetary. As you know, in New York State, it is a governor's budget. The legislature can only subtract and delete or hold out, meaning that we can hold out and say we're not going to pass a budget unless the governor gives us certain things that we want. Unfortunately, this particular area, and it's not my decision, is not an area where the legislature has historically been willing to say to the governor, we won't pass a budget unless you give us additional funding in this area. I think this year, I'm hopeful that we can restore the cuts to job search, transportation, et cetera, that are in the governor's budget. I'm also hopeful that we can get the 3.2% COLA. I certainly agree with Chairman Gunther of Mental Health that the COLA should be 5%. But again, I've been on this particular issue for a long time. I think we need a bit of a revolution in revenue raising before this area or mental health is going to get the treatment that I think it deserves in the budget. I would point out in the mental health area, because I sit at that table, that the governor has done a lot to increase mental health beds, and also is very supportive of community behavioral health centers, all of which is to the good. But there's been no real sustained effort to increase funding for intermediate or transitional care, because people in mental health or substance abuse crises, when they get out of the hospital, aren't really ready for independent living. So I think we need to do a lot better in this area. I think the assembly stands willing to do that, but unfortunately, to be honest, I haven't seen that we're willing to say we won't pass a budget unless there's significant increases in funding in this area.
Thank you, Assemblyman. As I said earlier, Senator Fernandez is also going to be joining us. So when she gets on, we'll take a second to let her introduce herself. She's the chair in the Senate. I also forgot to remind everybody about our upcoming town halls this week and next. This week we have the mental health town hall on Wednesday, and on Thursday we have the developmental disabilities town hall. And then next week, I think it's Monday and Wednesday, we have the youth justice town hall and the child welfare town hall. And that will wrap up our town halls for 2024. And then everybody starts getting ready for the Family Empowerment Day in the well of the Legislative Office building on the 18th. So again, I just want to say thank you to everyone who's joined, and turn it over to Brad Hansen, our Director of Public Policy. Brad?
Thanks, Paige. Quick amendment. It's actually March 19th, Tuesday, March 19th. It's okay. And I just, for everyone's knowledge, I also added our webpage that details all the information that Paige just shared in the chat. Also want to welcome Senator Natalia Fernandez. Thanks for joining us. You arrived just in time. We're doing brief remarks, opening remarks, and introductions. So if you're ready, go ahead.
I am ready. Thank you so much. And forgive me for not being in my office settings. As you can imagine, Albany is just always crazy. So like in the well right now. But I had to come on, not only because I RSVP, but because we have to keep the momentum going for these initiatives to help our families, help our loved ones, getting the services they need, and really looking at the process and streamlining it better. You know, there's too many barricades that arise when you might be jumping from different services, different agencies, but also the time, you know, I feel like it takes too much time to get things approved to make sure that families will be met, you know, their needs met, meeting them where they are, and feeling empowered, you know, in their need, and honestly advocacy, because everyone's story is in addition to highlighting them, having events like this, and working with legislators. You know, we are successful in the changes that we want to see that's being done. Happy to be a partner on. So thank you so much.
Thank you, Senator.
Thank you.
I just wanted to quickly let you know that some of your audio is coming out very gibberish. And I don't know if there's a possibility of you being in your office where you have Wi-Fi, but we can wait for you to get up there and go forward with the other panelists if you want to, if you have time to get up to your office. If that would help.
Worse.
Sorry, we're losing you. We can't hear anything you're saying, Senator. We'll hope that you are able to join with Wi-Fi in a second.
So this is going to cut me out.
Okay. Well, we're working on her tech issues. I'm gonna just and let's get into the questions. Hi, but first of all, I'm Brad Hansen. I'm the policy director at Families Together in New York State. We have a great slate of questions from parents, young people, talking about the very issues that our panelists have mentioned in their opening remarks. Addiction recovery is possible. and we have to address the underlying issues soon. Right, that's the crux of our perspective here as an organization interested in youth mental health, youth behavioral health, and their general well-being. And so I heard some great themes that I think are going to come through today. Let's start with our first ambassador, Ashley Dixon. And as a brief reminder, each panelist, try to keep your remarks to just under 3 minutes. You'll each get a chance to respond. We have 4 questions total. And for everybody in the audience, if you have questions and things you want the panelists to see, you can put that into the Q&A section in the Zoom. All right, Ashley, go ahead.
Thanks, Brad. Hi, everyone. My name is Ashley Dixon. My pronouns are they, them, theirs. I live in Tompkins County in central New York. I'm a person in active recovery since 2016. I'm also a certified recovery peer advocate, and I hold an AAS in chemical dependency counseling and a BS in human services. I work at Tompkins Cortland Community College as the OASAS Special Populations Coalition AOD Prevention Grant Coordinator, and I work pro bono as the Collegiate Recovery Program Coordinator. On the 26th of February, so just last week, the Alcohol and Drug Council of Tompkins County, one of only 2 outpatient clinics in our county and one of only 4 in about a 20-mile radius, announced their immediate shutdown. This agency opened in 1965, 60 years ago, and has been crucial to those in recovery. ADC also opened a detox facility last year in 2023, the only non-hospital medical detox in our region, and has faced chronic staffing issues. This shutdown means that we are losing SERPAs, they are losing jobs, we are losing dual diagnosis programs. It means many clients of this agency are now adrift with limited options for continuing treatment. We're in a rural area with very few agencies, so many of these clients may have already been dismissed from the other agency available to them. This is an unfortunate, concrete, and present example of the workforce shortage that we're facing in the human service sector in New York. The funding and workforce are not there to meet the needs of providers and those who need services. A fully funded cost of living adjustment would be a small start to fixing this crisis, and the number in the governor's budget is inadequate. So my question is, what is OASAS and the legislature doing to keep services open for New Yorkers in recovery? Thank you.
Excellent question, Ashley. I'm going to open this up to whoever wants to answer first among our panelists. Anyone dying to answer that question? Commissioner, you're unmuted.
I'm sure. I'm happy. So, certainly we're aware of the closure that you're talking about, and we're working with the programs in the community to make sure that the services remain available. We know how important it is that the services still remain, and they will be, and we're sort of figuring out and working with several different providers to make sure that happens. We definitely recognize with workforce is a huge issue. And I also want to say, it's actually been an issue for decades. This is not new. It's gotten worse, definitely, with the COVID pandemic. I mean, look, I'm a physician. I worked in the Bronx in the hospitals during COVID, the first and second waves. I know what it feels like. It was so traumatic. It's exhausting. And then, of course, we have the overdose epidemic on top of it. And so we know that the field has really, is exhausted, it's been traumatized, and really has not been invested in for decades. So recognizing that, we've made a ton of investments in the workforce. When we first got our dollars from the COVID supplemental dollars from the federal government, the first initiatives that we did were to stabilize the programs and the workforce, and that was $80 million. We've also, had 3 years now, back-to-back COLAs, the cost of living adjustments, which is $76 million for the OASAS budget. And then we've done a host of other things, not only to support the existing workforce, but to also create the pipeline, because we have to, get people to come into the field, again, because we're decades behind. So we need to do both of those things. So, the healthcare worker bonus is one initiative where, frontline workers had bonuses in the last 2 years. That's still ongoing. We've increased minimum wage. We've provided scholarships for counselors, right, for SERPAs, for professional prevention professionals. We have fellowship programs with medical schools across the state to build, in doctors, social workers, nurses, physician assistants to go into the field of addiction. We've also have paid internships. That's something that we just came out with, and we're working on the loan repayment program that we'll be coming out with shortly. And then, we've also heard, because certainly money is important, but it's not the only thing, that there's also sort of the burnout and the exhaustion. And so a leadership development institute is something that we also just put out an RFP for. So to help the workforce, have the professional development that they need in order to remain employed. So really, I don't think that, look, we're not unique, the field of addiction. We're not unique in healthcare. We're not unique in New York, right? This is the workforce issue is a problem really across many industries and many parts of this country. There's not one silver bullet here that's going to fix the problem. And so we're really trying to attack this from many different ways. And we are making real investments, certainly well over $100 million in all of these ways to really support the workforce.
Thank you, Commissioner. I'm going to now pass to Assemblyman Phil Steck. Same question.
Well, I think we need to look at this from a, more from a larger perspective than from the perspective of a program here and a program there. The bottom line is, as long as the state is going to give $400 million in tax credits to Hollywood producers, $1 billion to the Buffalo Bills, $2 billion to the government of, Abu Dhabi for its chip fab plant in Saratoga County. You're not going to have the money in this field. Revenue is not endless. So I think the only solution that I see is to reinstate the stock transfer tax, which New York had from 1905 to 1981. If it were reinstated, instead of being rebated back to Wall Street, we would be raising $14 to $16 billion a year. And obviously not all of that is going to go into this area, but it would free up money that is in the budget that has to be devoted to areas like this because we don't have sufficient revenue. And we would be able to do a lot more. So at least from what the advocates tell me, it doesn't seem that we have done enough in this area. And we held hearings on the workforce problem. I've made a variety of proposals, but anything that requires hiring new state employees gets rejected by the governor. So I have to say, unfortunately, maybe the commissioner's correct and all these problems are being resolved, but that's not what the advocates are telling me when they come to my office.
Thank you, Assemblyman. I'm now going to pass it to Senator Fernandez. Same question.
Thank you. Yes, this is, I think, one of the areas in this world that needs a lot of help in. I think it's been said here, but I agree with Assemblyman Phil Steck. The stock transfer tax is something we need to bring back. We need to tax the billionaires. We need money. We need money in this budget to be able to complete the wish list of the 3.2 COLA. It should be more. Looking at what the salaries that our providers are getting paid should be more. There is an incentive that can be strengthened to make this world livable, and livable, just a sustainable income, so you can give your all and your attention to this field, to the people that need the help, to get them on their path to recovery. So there are options out there, and we just need to be bold enough to do it. And for the last couple of years, these options of real revenue raising possibilities have been sidelined. And I don't think we can do that anymore. We need to let the bench warmers off and get them in the field, so we can really see the the improvements in what our providers and employees are being paid, but also give the state the resources that it needs. It was great to see that. Well, it was great to have. We had a lot of money from the pandemic, terrible circumstances, but it did help us a lot. And now that we're out of that money, we're in a deeper hole than we've ever been, and we need to be bold and get these incentives done and passed so we actually have some cushion and a support system to do so. And even though no one has really agreed on other revenue raisers, I have put my word out there. I wrote a letter to the budget and my budget priorities asking for $500 million just for workforce. This is outside of the COLA, because even if we do raise the COLA, we know that the COLA is not going to go to every salary increase. It goes to a few other things. So this conversation, we're ready to have, Steck and myself. We've been having it, but I think at the state of what the crisis is, we really need to be committing to taking these actions and providing for ourselves.
I mean, I could certainly talk about some of the positive things that have occurred, but at least the sense that I'm getting from all the advocates that come to me that we need to do a lot more, and I'm certainly in agreement with that.
Yes, and thank you both. Thank you all three of you for your responses. As a quick addendum and editorial, as the moderator and as policy director of Families Together, I think everything the commissioner said are positive things and pushing us in the right direction. And I also agree. We also agree with the legislature that we believe OMH and OASIS and others could do more. They could do better with more, and we certainly agree that these investments are necessary and urgent. And so we do want to reverse these long-term trends that have been discussed so far. And tax revenue or whatever else is needed to raise revenue and increase resources that can go to these systems is what this moment calls for. So I'm now going to move on to the next question. Let's go to Ashley Livingston, who's going to ask an additional question. Go ahead, Ashley.
So I just want to say, my name is Ashley Livingston. I'm an individual in long-term recovery. For me, that means that I haven't used a mood or mind-altering substance in over 10 years. I'm also a certified peer recovery advocate. I train it. I do lots of other things, but I'm an advocate overall. And I just want to say I was glad to hear the two legislators speaking about revenue, because that's going to lead right into my question. So numerous studies have shown that there is a link between poverty and addiction and mental health. Children living in poverty are more likely to experience trauma, addiction, mental health, and other adverse social and health experiences. The impacts of living in poverty is also long-lasting and follows those individuals even if they are able to escape poverty in adulthood. The impacts of living in poverty have been shown. So we know that access to income, food, housing, and childcare are essential to family well-being and healthy child development. And in fact, there are proposals to address some of these social determinants of health, such as the Working Families Tax Credit, despite claims that we can't afford these investments. Our state leaders were able to find $850 million for a football stadium. So it seems the priorities of our state leaders are skewed. Instead of funding services or providing the economic stability for New Yorkers' most vulnerable populations, they gave money to billionaires. Well, we have lost enough New Yorkers in a year to fill one grandstand in a stadium. OASIS, the agency that is responsible for providing services to individuals with SUD and could potentially decrease the loss of lives, has a flat budget. And millions of dollars will go to build a new stadium, which saves no lives. So what is your stance on revenue-raising policies to provide stability and proper funding for addiction and mental health services in the state? What is the state doing to address the conditions of poverty and economic hardships that are often precursors of adverse health outcomes like addiction? And I'm going to add on, because it does seem like you all are in support. I understand that the governor, creates the budget, but what is the legislature doing to apply pressure to the governor to get these revenue-raising policies over the hump, right? Because as the legislative body, you all do have some power in terms of holding out. So what are we doing to really move and engage other legislators to support these types of initiatives? Because we now all have agreed this is an issue. With these, we would have the proper funding. So I'm really curious. I'm glad that you guys are in support, but what are we going to do to make it happen?
So I really want to answer this question because 3 years ago, when I was trying to get the stock transfer tax passed, I got 58. I worked my tail off and I got 58 co-sponsors on the bill. A very funny thing happened, which is that a number of members of the Democratic Socialists of America were elected from the city of New York. And I thought, my God, they're going to sign on to the bill. They didn't. They made their own proposal, which deflected attention from the, what we needed to do to try and get the stock transfer tax rebate ended. So, I personally am known. I mean, every time I talk about the stock transfer tax, it's almost like humorous because everyone knows it's something that I'm really committed to. But getting legislative leadership or the governor on board with this is very difficult, and I want to say why. We have been operating since 1980 under an economic theory called neoliberalism. And neoliberalism involves things like giving money to billionaires because we think, or the people who advocate for it, think it's going to improve the economy. It doesn't. So that what improves the economy is average citizens like everyone on this call having enough income to spend money in the economy, and that's what drives it forward. So I am not on board with the overriding economic philosophy of New York State government. So I can't tell you what can be done. We just had a conversation about good cause eviction, and everybody is complaining about good cause eviction. But I support it, and I want to make a point here about the high cost of housing in New York. If people are paying too much money for housing, too much money for medical care, too much money for energy, they don't have any money left over to spend on goods and services in the economy, and it's extremely harmful to the economy, and it's especially true in upstate New York. So I don't know what to say, Ashley. Maybe you could give me some ideas as how I could convince my colleagues to go back to the principles of Franklin Roosevelt, but I try.
Thank you, Senator.
Wow.
Yes, go ahead, Senator.
No, thank you. To almost the same sentiment, I do think we're doing what we can with the powers that we have. We're signing on to letters. I know I am. Attending rallies to, literally give that pressure force, that visual to the governor of, how much people care about it. Actually, at 12:30 now, Invest in New York is having a rally in the War Room, I think it is, to continue to advocate and make noise on this. Making noise educates the public around you. And the more that we can get, I think, the general voter to speak to their legislator, to then put pressure on them, asking them to sign these bills, that is a step forward. Again, internally, what we're doing, speaking up in conference, where it does matter. Showing up where it needs to, speaking about it any which way you can is a force that we have. Is it a strength? Is it a tool that's working? I don't know, because I know we do that with a lot of other issues. But I think numbers is where we can, show our feat of strength in presenting the facts, because numbers don't lie. And if it's not adding up, the math is not mathing, what else do you do, except add more? So the pressure remains, it hasn't gone, but it's just consistency, the squeaky wheel gets the oil. So we have to keep squeaking.
Thank you, Senator. Commissioner?
Sure. So, I certainly agree that a lot of these social determinants of health, as Ashley brought up, are really important. And, we recognize that and really have used a lot of resources to support those social determinants of health. And so just to also say, and certainly, recovery is such an important part of the whole continuum of services that we have at OASAS. And So really supporting recovery field and work, it is very important. And, we've used our dollars to invest. And so just kind of some examples here include, the recovery centers across the state. We really bolstered their budgets, investing the opioid settlement funds in all of them to really expand their reach across the communities. In addition, continuing with our youth clubhouses. In terms of the workforce with the SERPAs, we, as I mentioned before, we have scholarships for SERPAs that we certainly are investing in, and increasing the Medicaid rates by up to 40% for in-community work for SERPAs. Definitely know the value there for peers who are doing this work. I personally worked with peers for my whole career and learned so much from people with lived experience. Also, making sure that people with lived experience and living experience have a voice. We have a new advisory panel called LEAP at OASAS, where that advisory panel, gives me, the commissioner, recommendations. So really, an important new way to really bring these voices to the table, I think, in a way that has not been done before. Transportation, huge issue. We know this is a big issue, especially in rural communities, and, have invested millions of dollars in non-medical transportation across the state. And again, used our opioid settlement funds for this as well. Housing, I mean, obviously Assemblymember Stack talked about housing. We know it's such a big issue. This is part of the reason why recovery housing is now going to be under the OASAS umbrella. We just put, regs out for public comment. We got a lot of comment. We're revising that and plan to post very soon. And, moving forward with that, I think that's going to be a really important part of the continuum. So there's recovery housing, there's transitional housing, which we continue to expand with opioid settlement funds as well. So people coming out of residential treatment or out of jails and prisons have a place to go to transition as they go into permanent, more permanent housing. And then, of course, we have, our permanent supportive housing as well. And then just employment, we know, is also important. And so that we have the recovery workplace tax credit as well to really encourage employers to, provide employment to those in recovery. So I think really we do recognize the importance of this, and we are investing in these ways that we've heard from the community, from providers, about where additional support is needed. And, have been working with our sister agencies as well to make sure that Medicaid can also support, some of these, different kinds of social determinants of health.
Thank you, Commissioner. Thank you, all the panelists, and thank you, Ashley, for your excellent question. And yes, with more revenue, Oasis could do more. I doubt the Commissioner would disagree with that. And so I'll now get the next question queued up. Pam, you want to ask a question about harm reduction, so go ahead.
Hi, thank you for having me. Hello, my name is Pam Brannon. I'm speaking today as someone whose parents, siblings, and whose own children have struggled with addiction and mental health. 2 of my grandchildren were born addicted, and they lost their mother to fentanyl 5 years ago. I believe that if harm reduction strategies such as Narcan, fentanyl test strips, overdose prevention centers, MAT, and others had been more widely available in communities like mine, these beautiful children would still have their mother today. She may, in those 5 years, have found a path to recovery, as many do when they have the support they need. But most importantly, she'd still have her life. You can't recover if you are dead, and that's what this system still doesn't seem to understand. What will New York State do to ensure that harm reduction approaches are everywhere, that people see the humanity of those struggling, that pathways to treatment are unfettered by judgment, and that for-profit insurance plans no longer discriminate against our loved ones by denying claims, underpaying, and delaying payments to providers?
I'll start with that. Thank you, Pam. You are singing exactly the song that I am singing as well. I mean, I came to this agency saying harm reduction has to be part of the priority. I mean, look where we are in terms of the overdose epidemic. And there's decades of research that show that harm reduction is effective. A lot of it has been around HIV, but certainly a lot of it is around substance use as well. And we have to keep people alive, period. That has to be the focus, right? As you said, if people are not alive, then we don't have opportunities to work with them in other ways. So, for this reason, I mean, we established, one of the first things I did is establish a harm reduction division so that we have, now prevention, treatment, recovery, harm reduction, and recovery. I call that the four-legged stool. Like, we have to have that, and harm reduction has to be infused across the system. We certainly have really put a ton of effort into making sure that harm reduction supplies are available for free across the state. I hope that you saw the public awareness campaign. There's been now a second round of this as well. I mean, we've gotten really good turnout. We've shipped out over 70,000 naloxone kits, over 5 million fentanyl test strips, and 4 million xylazine test strips, right? They're free. They're available on our website. It takes just 15 to 30 seconds to order them, and clearly people want them and are ordering them. So clearly we see the need. We also, have drug deactivation bags and medication lock bags, and we're working on drug checking machines. So all of these are ways that are harm reduction, materials and efforts to really help keep people alive. So in addition to those supplies, of course, there's the harm reduction approach, right? The really philosophical approach to have low barrier services, to really treat people with dignity and respect and not be judgmental. And some of the ways in which that you can see that and the investments we're making include outreach. We have to meet people where they are. We can't wait for people to come to us, right? And so we've invested in, street outreach. We're working with subway outreach. We're doing outreach in communities under the bridge, right? And working with our providers who both are clinic-based and non-clinic-based. We're also going into homeless shelters, meeting people where they are. And so these are the kinds of ways which we're saying we really need to embrace a harm reduction approach. And when you talk about medication treatment, I mean, that is 100%, to expand that and make it low barrier is absolutely part of our priorities. We have a low threshold buprenorphine initiative so people can get buprenorphine that day that they want it. I mean, we have initiatives where we're going into parks to provide buprenorphine treatment, meeting people where they are. I mean, this is different, right? I mean, and so it's good. Let me just say, for some people, they've been practicing harm reduction for decades. For some programs, not so much. And we're really trying to move the system. As you can imagine, that's hard to do, especially when it's been really so abstinence-based for decades. Of course, abstinence is still important, but we know that not everybody can achieve abstinence. And we can't lose those people just because they can't achieve abstinence. So we have to change our system. We're working to do that. Some providers have an easier time with it and some have a more difficult time with it, but we are there to facilitate that and continue to make sure that that is part of what we're doing. So, I mean, 100% with you, 100% with you.
Thank you, Commissioner. Senator or Assemblyman, either of you want to respond to this question?
I'll continue.
Yeah.
I want to thank the commissioner because yes, the efforts are more than what we've seen. The fact that we do have mobile vans now going straight to communities is something we've never seen before. We are expanding the test strips, and I have legislation to really allow these test strips anywhere, especially for xylazine, which we're seeing a growth in pharmacies and in our schools and public places, because there's still that stigma that someone won't go to Oasis, they won't order it, but if it's there, maybe they will grab it and test and save their own lives. The drug testing machine, thank you so much for mentioning that, because yes, that is a tool that some drop-in centers have, but that tool needs to be as possible and far and wide for everyone. So I have another piece of legislation that would allow certain clinics and institutions to purchase a drug testing machine and have one and, purchase it with Oasis dollars to have it to add to the research that we so desperately need. Right now, every sample that is coming off the street is a mix. There's nothing that's straight heroin, that's straight crack. It's all a mix with fentanyl, with xylazine. And people need to know that. We need to know that for our tracking as to what's out there and maybe in what areas it's in. So that, I think, is going to be a greater tool than things like scheduling to help, stop the deaths. People need to know what's going on. We need to know what's going on. And if we schedule, they're just going to make another new drug on the street that's going to be probably just as addictive and just as deadly. And, having these type of approaches, I think, is smarter than just, the quick abstinence, which is what the commissioner said. That's not the solution right away for some people at the place that they are, but meeting them where they are and keeping them alive to get them to a place where they're ready to take that step in recovery is so important, which is why I support the expansion of OPCs, because, we're keeping those people alive so they can learn the resources, learn about what they're doing, maybe have that come to Jesus moment finally after the 100th time, because sometimes it takes that long to press and press and to finally get them comfortable, ready to make that change in their life, to do so. So there's so many things we can do. And I even have legislation to, look at other possible medicines. Again, concerning with the governor's scheduling, I have legislation to look at psilocybin. There's a lot of research about what psilocybin has been able to do for people, especially our veteran community. They've been the strongest force now, to my attention, about how this, medicine, this tool has helped them reverse their addiction tendencies, to step away from suicidal ideologies, PTSD, addressing that. Like, there's so much potential that we need to research more there, and I don't want that to be stopped because a scheduling was done just to make it seem like we're doing something. So yes, thank you for that.
So I just wanted to
Senator,
say,
go ahead.
yeah, I'm not going to add a lot here, but just to say that the commissioner has been extremely strong in this area. And, I also support the overdose prevention centers. When I was running for re-election, my opponents argued that I supported allowing addicts to shoot up in front of school children because I support overdose prevention centers. So I actually come from a district that's it's become, I would say, more conservative than when I first was elected. But I think people understand that we need to get drug addiction out of the shadows under the supervision of medical professionals who can hopefully get people convinced to proceed into treatment. So I'm a very strong supporter of the overdose prevention centers. I understand the political, issues there, but I think that, as with everything, where there's a will, there's a way.
Thank you, Solomon, and thank you everybody, all the panelists, for your really thoughtful responses, and for Pam for being so vulnerable, and sharing that lived experience in your story. It's incredibly courageous, and really appreciate you doing that. So thank you. And I think also, in service of that story, one key part of Pam's question was regarding insurance and the role that companies, for-profit companies like managed care organizations and commercial insurance plays in this crisis, in denying payments, denying claims, and truly being a barrier to a lot of the great things and programs that we were talking about just now. So I just wanted to lift that up, and maybe in the next response you can start to think about ways that you may be addressing that issue as well. I want to move now on to Daphne. Daphne, are you ready to ask your question?
Sure. Good afternoon. My name is Daphne Brown, and I'm in Rochester, New York. And I'm the parent of a young person that has struggled with substance abuse and mental health challenges. And I kind of feel that we must have a cross-system collaboration across all systems when we are trying to help our young people recover. One of the things that our community needs are outpatient and residential addiction centers that really specialize in meeting the challenges that young people face. A lot of times they go to residential programs or programs that are, and they're in there with adults who have more difficult challenges than what a young person is actually experiencing and really don't have a voice for what they're currently experiencing. So I have two questions. What is OMH and OASIS and also the school system? Because a lot of times our children, their education is disrupted when they get involved in substances. What are we doing to jointly help prevent young people from becoming addicted to substances, including connecting young people to mental health services that address the challenges that young people feel, such as anxiety and depression, and also educating our young people to prevent them from engaging in substances, but to also to increase healthy coping strategies?
I'm happy to start. So definitely agree with you that there's unique challenges for young people that is really different than older adults. And so this is something that we definitely focus on and are continuing to support and expand. So let me just say too, going forward, particularly when it comes to mental health and substance use, we work very closely with the Office of Mental Health. And some examples of this include, as we're going forward, really thinking about how services can best be braided, the sort of funding streams, so that people can get both mental health and substance use disorder treatment. I mean, I think you may know our federal dollars can only be spent on addiction services, and then OMHs can only be spent on mental health. So we have to overcome that barrier to really think about how to braid our funding resources together in order to so that obviously the individual shouldn't care about that, right? Mm-hmm. About the federal government and the bureaucracy there, but we have to care about it and think about how to overcome those obstacles. And so some examples include the CCBHCs, or Certified Community Behavioral Health Clinics, which we're tripling in New York State. And so those, from an outpatient program that serve adults and children, that have all the wraparound services so that people with mental health or addiction problems can go into those CCBHCs. They're staffed with experts in both of those areas and have all the wraparound services to ensure that really care is comprehensive. That's a key, I think, path forward. And we are actively tripling those numbers across the state. Another example is the crisis stabilization centers. Again, OASS and OMH are working together. So 24/7, open doors, children and adults for any substance use and or mental health crisis. Instead of going to an emergency room where those providers are not trained as behavioral health experts, this is a place to go really for behavioral health urgency where you have appropriate staffing. So those are some kind of examples. In addition, schools, as you mentioned, important part of our prevention services happen in schools. We're about 25% of New York State schools, and we want to be in more. We work with the school districts who may or may not be as welcoming to OASAS services. So we really try and work with them, but ultimately it's their decision. And as OMH is continuing to expand their school-based clinics, we're really working side by side to say, listen, you're expanding mental health. Let's make sure that there's addiction prevention services hand in hand as you're building those out. And so that is what's happening as well. I also want to say in terms of residential treatment, so we actually have specialized residential treatment programs for adolescents and young adults in New York State. And in fact, just a couple of weeks ago, a study was published that looked nationally at every state at what access to care was for adolescents. And we in New York were only included in a handful of states where you could get same-day access, Medicaid would pay for it, and you would be offered buprenorphine if you had opioid use disorder. So only a handful of states had that, and we were one of them. And so, we are working with our residential providers to make sure, and we do know that there is availability in beds. Perhaps some communities may not know, and it's not, and there may be, a drive in other communities, but I think we do have to do a better job making sure that communities know that resource is out there. So let me just pivot for 1 second because I do want to talk about insurance. big issue. Big issue. I can't even tell. Listen, as a physician, the number of times that I have personally had insurance companies reject care for my patients, I mean, you want to drive me crazy? This is one way. I mean, crazy, right? Because I know that then if my patient couldn't get services, they were at such huge risk of overdosing, and now dying because of the drug supply. And so this, I mean, is just get under my skin. And so we, there are many right now, what we call Article 7, so legislative changes that have been proposed to really deal with insurance companies. And at OASIS and at OMH, like, we don't work directly with the insurance companies. Those are our sister state agencies that have to hold these insurance companies accountable. And so we have proposed the legislation around making sure that actually the rosters of providers are real, right? That they're not just like providers that don't exist, requiring available appointments within 10 days of a phone call. And if that can be done, then going out of network and not having out of network charges, right? And holding in addition, holding those insurance companies accountable for the rejections that are not to parity with the other physical health issues, really holding them accountable and getting those fees from them so we can reinvest it back in our system, as we've done already with like $40 million, put that back into Medicaid rates to bolster them. So this is a big issue. And this year, there's a lot of legislation that has been proposed to really make insurance companies accountable for these issues.
Thank you so much, Commissioner. And just for the record, Families Together is in full support of both the network adequacy regulations, which would create a time limit of 10 days. If the insurance plan cannot provide services within those 10 days, they have in network, they have to cover out of network. Those ones, we support them. And in addition, the governor's proposal to make commercial rates match at least Medicaid rates, we also strongly support those. And we understand that some commercial insurance plans pay outpatient clinics 50% of what Medicaid does. And you can tell in our advocacy that we don't think the Medicaid rates are high enough. And then you learn that commercial rates, for-profit companies are paying half that. That's a completely unacceptable status quo. So thank you for your comments and appreciate what the governor has put forward. Assemblyman Steck and Senator, either one, whoever wants to jump in.
I'll agree that that's a great a point that the governor kept in the budget or put in the budget. The parity, huge issue. I'm looking at a way to maybe take it a step further by still requiring the service to be provided, even if it doesn't match. Because if not, then that's still somebody that may be at a loss at the services that they need. The speed, yes, it's terrible that it could take 6 months sometimes for someone to finish their services at Oasis and then try to go to mental health services. And even just the wall that exists sometimes with the two agencies, I really think needs to be continued to be taken down. I've been very supportive of Pete Harcum's bill to merge the two agencies, just so there is a complete, unification of the work and the areas that need to be taken in that particular person's journey. I do have a bill right now, if we can't get to the merger, I have a bill now to remove copays, because even copays can be a barrier from someone going from one service to another. So if you're in mental health services, but then maybe needing to go into Oasis services, that jump shouldn't be withheld just because you can't afford the $40. But it's just so critical that we keep trying to fix this, not perfect system. It's not broken, but it's not perfect, to help people get the help as they need it, when they need it.
Thank you, Assemblyman.
Yeah, I mean, I'm kind of the mind that the health insurance system is broken, but that doesn't mean that we shouldn't support all these pieces of legislation. I mean, the senator points to a bill that she had. A lot of the bills that are in the governor's budget existed in the legislature before they were added to the governor's budget. We're hoping that because they've been added to the governor's budget, they will get done this year. With respect to the question about schools, there is an excellent program in the city of New York called SAPIS, which attempts to do the things that you were requesting regarding educating school children about problems with substance use. And unfortunately, this program in New York City is kind of up in the air a little bit right now, because we were told that the city of New York was no longer going to fund it. And the way SAPIS works is it's a 50% state funded, 50% New York City funded. So in answer to the lady from Rochester, one of the difficulties with programs like that is upstate, it doesn't exist because there's no one willing to match the funding that the state would provide. I have to say that crisis stabilization centers have been since they were in the works before this commissioner. They somewhat mystify me. I don't understand how 24 hours is enough for this, particularly when we had passed legislation allowing hospitals to hold people for 72 hours. But nonetheless, yeah, so I would say that I'm just kind of mystified by that one.
Thank you.
So we are officially out of time. And I think I have the sense that we could have kept going for another hour. But I appreciate so deeply all of you for participating, all of the people in the audience. Thanks for being here and making time out of your day, and all the ambassadors, our family and youth advocates, for courageously sharing your perspectives and your stories. This will be live on Facebook. If it's available, it will be available on our YouTube. And there are 2 more town halls this week: mental health and developmental disabilities. Please be sure to plug in. And then 2 more additional town halls on youth justice and child welfare later this week. All that information is in the chat. You can also please fill out the evaluation forms. It helps us make sure we're doing a good job and deliver the kind of content that you all want. Thank you, everybody. Paige, I don't know if you want to say any closing remarks.
I think you did a great job, Brad. Thank you, all of you, for the panelists, for taking the time, and the people who asked the questions for being so vulnerable and courageous. Thank you to everyone who listened, and we look forward to seeing you at the mental health one on Tuesday and the DD one on Thursday.
Thank you. Have a great day.